everyone, we're here at MXL Live Loft Studios, and I'm joined by two great friends and business partners, Dr. Sanjeev and Michelle Rodrigues. Hi, guys.
Hi.
We're actually going to be talking about Peak Human Labs. So what is Peak Human Labs, and tell me, what does it mean to be a peak human to you, Dr. Sanjeev?
Yeah, so I mean, this started maybe about a year and a half ago. I was really involved in the biohacking space, and I was always trying to think, you know, the question we're always facing is how can we be our best?
Yes.
Like, what is it, you know, what are the tools, what do I need to know that I can make myself the best?
In terms of
physicality, mentally, and even spiritually.
Okay.
I would say those three: mental, physical, and
spiritual.
And spiritual.
All the trilogy. That's awesome.
So that's what really Peak Human's about, is that, you know, we can all go through life just being average, but if we want to be at the top of our game, how do we do that?
Right. When I think peak performer,
Yes.
you know, peak everything. So how did this come about then? You had a regular general practice. Mm-hmm. Were you treating athletes? And what does biohacking mean? Like, what do you mean by biohacking?
Yeah, so let's start. Biohacking is a kind of a term that's about where we give power to the person so that they can go and use the technology and understand their own body.
Okay.
So they can hack their own body to make changes. So like when you wear one of those wearable devices like a ring or a Fitbit or something, and you're tracking your activity and you're deciding, okay, I'm gonna take this supplement because, you know, my blood pressure's low,
right,
or whatever. That's called biohacking. That idea, the concept of being able to hack your own body and change yourself based on that.
Part of that is knowing your body composition.
That's number one, is knowing. Awareness of your own body is number one thing we can do.
So what's your role in that? Is it from the female perspective, or how are you helping clients at Peak Human?
So I'm the operations manager there. So basically from the start to the finish, I'm involved. We start with blood tests, genetic tests. We do supplements. We do everything from sexual dysfunction to skin treatments, hair treatments, body contouring. You name it, we essentially...
Yes. You name it, we fix it.
Yes.
So what's a popular service, or what if you notice something that people are going to specifically related to the pandemic? Are you seeing an increase in patients for a particular ailment? What's happening right now?
We see a lot of IV patients, so we do vitamin drips.
Especially for COVID patients.
Yes, yeah, we do immunity.
So is it like an immune booster to help prevent catching COVID, or is it just to build your immune system?
To build your immune system.
Okay.
We do a lot of antioxidants, glutathione, B-complex, high-dose vitamin C. We have a lot of first responders, from firefighters to police officers. We have nurses that come in on a regular basis, and it just helps them feel better. They're more exposed, and they feel better having weekly IVs.
And even vitamin D. I mean, we give injections of vitamin D because most people are deficient here in Canada. I would say 60-70% of people are deficient in vitamin D. Now,
is a lot of the treatment organic, non-chemical? Do you kind of take that holistic approach, or do you also provide, medication to patients?
Yeah, no, medications, this idea of what's natural and unnatural, I don't really subscribe to that. I think that everything is unnatural. Okay. We live in an unnatural world.
Okay.
So if medications are a good idea, then I'll recommend medications. Okay. Because even food is a type of medication, if you want to call it. So
is nutrition included in Peak Human and helping somebody's diet plan?
Yeah, I mean, food is 80% of the solution and the problem. So
a diet of pop and chips is not probably best.
No.
But one of the things I'm a real big believer in is this helping people to learn how to fast.
Okay.
And one of the amazing programs out there is the fasting mimicking diet. It's a 5-day program that you eat. You're still eating, but your body thinks you're fasting. So we're helping to train our clients on how to do this.
So does everyone at Peak Human look like the two of you? like lean body mass? Are you checking yourself? I remember going to the clinic doing the bod pod.
Yes.
Can you talk to me about tell everybody about the bod pod? It's very nerve-wracking, but So revealing.
Yeah, so the bod pod, I normally tell people it looks like a big egg you sit in. It determines your body fat percentage based on air pressure. It's very accurate, so it tells you your fat-free mass.
I know, it's very, very, very accurate.
Yeah, so it determines your fat-free mass and your fat mass, and usually that's what we start with.
Okay.
And then we come up with a plan, and 1 month from your plan, we redo it, and then 3 months from your plan, we redo it, and we see how well your fat mass has gone down and how your fat-free mass has gone up. So that's usually your muscle.
So how does Peak Human help with stress? I mean, a lot of people, you talked about the mental, the spiritual, the physical. How are you treating patients who are dealing with mental disorders or stress or mental health issues?
We take people who want to be basically at the top of their game, whether if they're dealing with anxiety disorder or depression. I think just the fact of having us as support to them makes a huge difference. Like, we're not here prescribing antidepressants and such. We don't necessarily believe in that model.
So part of it is they get direct access to a health professional.
I think that's healing. Just the fact of having somebody know that they care about how you're doing.
Right.
And that they can reach out to us, and Michelle's there, some major support. I think that in itself helps people get better, because they start taking baby steps to get, every little baby step gets them one step further.
Right.
And then their mood changes, and then because they see that they're making progress.
Yeah. So is Peak Human it's a private healthcare system?
Yes, we limit the number of patients we see, and they have direct access to myself as well as Dr. Goel. So we really have that personalized relationship with everyone. We get to know them, we get to know their family, everything they're dealing with. So they actually feel comfortable talking to us, and we build a bond with them.
Yeah. So it is not covered by OHIP. It's, patients pay out of pocket to.
But I believe the biggest investment you should make is really in your health and well-being.
Yes.
Yeah. No, I think what we're seeing is that, we can't even take everybody who's coming to us. It's become so overwhelming because people see the value in this, and that they're willing to pay because they're not getting that type of care anywhere else.
Absolutely.
So it's.
And can you talk to me a little bit just about stem cell? I'm so fascinated about that. How are you using stem cell to treat patients?
Well, stem cells sit in a bit of a gray zone in Canada, to be honest.
Okay.
But I can talk about how we think that they work.
Okay.
So stem cells are they can come from either your own body. So we can take them from your own body, or we can get them from umbilical cord blood stem cells.
Okay.
And so mothers make the donation of those umbilical cord blood, and they get those stem cells. But basically, what we think is that when somebody gets an infusion of stem cells, like Gordie Howe did when he
had an injury.
Yeah, an injury, and
right.
it worked. What we think is that the stem cells are sending a signal to your body to go repair.
Okay.
So that's how we think these stem cells are working. So, for example, the inside of a stem cell is called an exosome, and the FDA has approved already some topical treatments.
So rather than Botox, you can actually use it to have the youthfulness and collagen in your skin?
Basically, they increase growth factor. They have growth factors in the exosomes, which basically make more collagen and make your skin younger.
And something I recently learned about or heard of is PRP. Can you explain what that is and the use of PRP?
Sure. You want to talk about how PRP?
Yeah, so PRP is platelet-rich plasma. What we essentially do is we take your blood, we spin it in a centrifuge, we separate the red blood cells from the platelet-rich plasma, and we re-inject it. So it can be used in many different ways for hair. If you're
hair loss?
Yes, hair loss if you're thinning. It actually helps.
Even for women too.
Yeah.
Lots of women can buy it.
It actually helps rejuvenate your hair, help your hair follicles, strengthen your hair. It can be used in skin to help your skin stimulate collagen. It can actually help with the tone and texture of your skin. And in athletes or even just anyone with a joint injury, we can actually inject it directly into a joint. So like tennis elbow, knees, ankles, carpal tunnel. There's people like Kobe Bryant, Tiger Woods, it's actually a popular treatment.
And I heard it can help in erectile dysfunction. And can you actually increase size?
Well, apparently it does.
Apparently. Hey, gentlemen, PRP.
So it's
That's
basically called a
amazing.
P shot.
A P shot,
And so
okay.
what we do is, so we think that, so basically the platelet-rich plasma has some of these same growth factors. So it's
So
like,
you will
it's like a
inject
mini stem
directly
cell. It's like-
into the organ.
Exactly.
Yes.
It doesn't hurt, like we freeze the
Okay,
area.
okay.
And same thing for, it's called an O shot in women.
Oh.
Where they inject around the
Yep.
clitoris.
Okay.
And,
So
basically-
it'll increase sexual stimulation?
Yeah, increase sexual sensation. So,
Okay.
Yeah, so,
Is that for women post-menopause or just anybody that needs help with arousal?
yeah, I think it could, in both cases, I mean, as we get older, it does,
Okay.
things do change, so it
I
will
feel
help
smarter
that.
with you guys and healthier. Amazing. Okay, so how do people get in touch with you if they're interested in inquiring or potentially being a patient?
Our website is pcumin.ca. Our email is bpeak@pcumin.ca. So they could shoot us an email or fill out the contact form on our website, and myself or Dr. Goel will get in touch.
Yes, and we're also available on Clubhouse.
Yes.
You're doing regular talks on Clubhouse, I think, Mondays at
Mondays.
2,
yeah.
and Thursday evenings at 6. PQmin Labs is coming to you on Clubhouse and here at MXL Live Loft.
Awesome. Thank you so much.
Thank
Carmelia.
Thank
you.
you.